Now in this presentation, we are going to study orientation of ECG record. What it means? I told you heart is a three-dimensional organ and we record from 12 different positions. Now we want to know which position, which electrode records from what part of heart. Now, for that, there are two major axes in which it is recorded. One is the frontal axis, that is from the front of the chest, and the other one is horizontal, that is in the chest. V1 to V6 is horizontal, and there is a frontal plane. Frontal plane of the body. Lead 1, lead 2, lead 3 is frontal recording. Now, lead 1, lead 2 and AVF are called inferior leads because it records from the inferior part or inferior surface of the heart, while lead 1 and AVL records from the left lateral wall of the heart, called left lateral leads, that is lead 1 and AVL. AVR records right side of the heart, from the right side of the heart. It is the only record which is recording from the right side. Now, then we come to the horizontal plane. Horizontal plane, that is recording the activity of right and left ventricle over the chest, that is from right side going to the left side. So, V1 and AVR is recording from right ventricle, V1 and AVR. Now, V3, V4, V2, V3, V4 records from the anterior surface of the heart, from the anterior view of the heart, while lead 1 and AVL and 5 and 6, V5, V6 is lateral, is giving lateral view of the heart. V1 and AVR from right ventricle, V2, V3, V4 anterior view of the heart, lead 1, AVL, V5, V6 from the lateral side of the heart. Then lead 2, lead 3 and AVF is recording the activity from the inferior side of the heart. So this is the orientation. Remember, this is a very important point to keep in your mind. Which recording is recording from what part of the heart. There is no true posterior view because the esophagus lies between the posterior wall and the heart. So that is why the true posterior recording is not available. Why? Because the esophagus is between the posterior chest wall and the heart. Then how to record this posterior activity? Posterior activity, true posterior activity is recorded by the electrodes, a special electrode which is known as esophageal electrode, which is also required in some different type of problem, and this is known as esophageal lead. Esophageal lead is not the part of the 12 leads. It's only taken when it is needed. So this completes the lecture on recording.